Hello everyone, my name is Laura Nello, and today I'm going to be talking to you about Marlene Smith's theory of unitary caring. So to illustrate her theory, I created a concept map that shows how it can be incorporated into your nursing practice. As most of you know, Marlene Smith is the author of our book, Nursing Theories and Nursing Practice. She's a highly acclaimed nurse scholar and theorist, and she's known for her research in healing touch therapies and metatherapy. This is one of the things that really drew me to her work, was my interest in alternative therapies. And I appreciate how her work focuses on a holistic approach to health and healing. So I designed this map to portray the 5 main concepts of her theory, which in my opinion are the basis for really understanding how to incorporate it in your practice. So in this scenario, we have a patient that has diabetes and end-stage renal disease. And he's a frequent visitor to the intensive care unit where I work and deals with a lot of pain issues and diabetic neuropathy. So as the patient's nurse, I will start off by really preparing myself to manifest intentions. This can be done by just reminding yourself to be really present with your patient before going into the room with them. This could be done through citing mantras or affirmations or set internal intentions. So I would do this by, before going to the patient's room, saying to myself, I will be fully present with my patient and I will do everything I can to help them right now and not worry about my other patients that I could be having. I think this is something that's really important, especially in intensive care, when I could have had a patient that maybe just passed away half hour before and now I have a new patient. I think you really have to kind of start fresh with each of them, as each of their journey is different and unique to each person. So by setting intentions beforehand, you're kind of setting yourself up for more success. So you also want to incorporate touch and eye contact, and like I said, just being fully present with them. So her next step in her concept in her theory is to appreciate patterns. This is done by really listening carefully and intently. You want to listen to them as they tell you their story and try to pick up any life patterns that you're hearing that may contribute to some part of their health journey. You also want to say questions like, say, what is going on, to kind of prompt them to tell you more about themselves and about their health journey. So if my patient with end-stage renal disease were to say that they are very hesitant about palliative care, I may say, well, what is making you feel that way? Or what led you to this decision? It'll help you to listen and grab the true essence of what your patient has to say, and it'll allow for you to better care for their needs and kind of be able to attune into their dynamic flow, which kind of leads us to our next concept, which is what, like I said, attuning to dynamic flow. You want to sense any deeper issues or things that might be preventing the patient from moving forward in their care or being more open to other types of treatments or therapies. So this is where it's really important to trust your patient's insights and show them that you value what they have to say. So if my patient were to say that they don't want any more medical diagnoses or medical things that they have to deal with, I could respond by saying, well, tell me more about why you don't want more care or why you don't want us to move forward. This can help also drive the conversation deeper, to resonate with them and to see the whole picture. The next concept you'll see is to be able to recognize the extraordinary in everyday life, or as Smith said, the sacred in the mundane. This is experiencing the infinite, as she called it. So you may experience a moment of grace or transcendent presence while you're in a relationship with others. This could be the patient reflecting on like a past health condition or before they were really sick, and then their current condition where they're having a lot of pain and a lot of medical issues, and then stating their condition, how they might see it in the future. It's kind of just recognizing, as she called it, a pan-dimensional awareness. So this past, present, and future. which I think is really important for the patient to recognize and able to continue to move forward. So towards the end of your interaction with the patient, you really want to inspire them to reach out and to invite creative emergence, as she calls it. So this could be pushing them to reach out to community resources or allow them any type of other resources that will allow them to live with greater ease with their health condition. You could use instruments like journaling, meditation, just anything that would offer some, in this case, palliative care, anything that would offer a relief of their health condition. So in this case, I would also kind of explain to the patient more in depth about palliative care and what it could offer. It could also be like therapeutic touch and massage. It could also be as simple as, like I said, journaling and just having them write one thing down every day that makes them happy, or that if they're not into that, could be having them write down one thing that before they have these neuropathy exacerbations that they experience right beforehand, or how they're feeling beforehand. Anything like that. This really incorporates her whole theory and will provide a therapeutic meeting with your patient. So further expanding on Smith's theory, we talk about her meta-paradigm of nursing. She viewed the nurse as a guide in the healing process, and the nurse-patient relationship as a mutual process relationship. She viewed the patient as the whole person, holistic, and believed in holism. The environment was family, community, and any surroundings that the patient came in contact with. Health she viewed as a journey, as in the patient was able to manifest their own health through their own unique journey. Some key assumptions that influenced her theory include ones that humans are unitary and in mutual existence with their environment. Caring was a reflection of expanding on your own consciousness, and healing is a dynamic, ongoing process of maintaining wholeness. As you can see, we have the 5 concepts here. We went over in the concept map. But one other thing to note is that she referred to empirical indicators, and this was taking the concept that we talked about and bringing it to life, or bringing it to another level where it could be measured and understood. Smith viewed caring as a multidimensional concept, and it really as central to nursing practice. So this is something I think I can really take and relate into my own practice as an intensive care nurse, and be able to take a step back and really work on setting intentions and being fully present with my patient.